Leap Health, a 1-star increase in a online rating can lead to a 5% increase in patient volume. So if you can go up higher in your ratings, you're going to make more money. Clinic schedules are going to be full. Everyone's going to be happy. Hey everyone, and welcome to the Dr. Marketing Tips Show. I'm Corey.
And I'm Jennifer.
And today we're going to be talking about reputation management and directory listings. And what we wanted to kind of hone in on is how it's actually changing, and as a practice, what you need to know moving forward. So today we're going to look at why these things matter, which if you've been listening to the show for a little bit, we talk about this quite a bit, but there's some very good reasons. So we're going to share some recent statistics on those things. And then also talk about how you can save some money if you are actively involved and paying for some type of a reputation management service.
Yeah, and I'm going to say, if you are considering or about to come up for a contract renewal, this is an episode that you certainly want to listen to, because the savings that we're finding are 50, even 70% sometimes on what that expenditure is for your practice. And we're going to actually open up the hood of the car and look under at some data and some real world examples. So some things that we're seeing in the trenches and how these directory listings and overall reputation management is directly delivering to some of the practices that we work with.
So let's start with the start. Let's do the main thing. So what is reputation management? So you've probably heard that term, or maybe you've heard online reputation management, or ORM is the acronym that kind of gets thrown around. Basically, it's just monitoring online reviews. Some people also say it's engaging on social or responding to this patient feedback and optimizing these directory listings. So it kind of goes beyond just the review piece of it, but at the very base level, that's what it is. It's paying attention to the reviews and the listings with things like, are your phone numbers correct? Are your addresses correct? Do you have a search presence? What are people saying about you? And then are you responding to those things? And then if you take that even a step further, because that's a lot of managing your reputation. If you take that a step further, it's also about improving your online reputation and some of the benefits that come with that.
Absolutely. And I think that these, just the specific example of, like, you're a patient and you're looking to find a practice that's going to serve your healthcare needs. You go online and the first thing you do is Google the name of the doctor and you find out if it makes the most sense or not. And a lot of times from a practice perspective, we are very focused on, what is my star rating and why does the star, I need to have 5-star reviews. I need 4.5-star reviews. That is just a piece of a much larger puzzle. Having directory listings that are correct, that's how you show up in the Apple Maps. That's how you show up on Google Maps. That gets trickled down across the board for your snippets. We've talked about how SEO is changing. Well, this is a very big part of your SEO and how you're showing up on that front page of Google. And now we're seeing, differences like potential new browsers that are out there. Just today, there was an article in the Wall Street Journal talking about how Perplexity, who has a valuation of $18 billion, made a bid of 30-something billion to purchase Chrome from Google because they're trying to get into the browser game. Well, this all plays into reputation as a whole, because whatever happens over here in left field is going to impact us in right field. And so the industry is changing so much. Patient acquisition is changing so much. And I just think, the specifics of, it's not just star ratings. It's lots of other ways that these directory listings and reputation management is driving patients to your practice.
Yeah, so a lot to unpack right there. I want to start with the last thing that you said there. So how it's driving people to the practice. So a couple of stats here from GetWeave. 90% of people use online reviews to evaluate new healthcare professionals. That's staggering.
90%, absolutely. Probably higher than that.
71% begin their search for a provider with a review site or a reputation management listing, like a Google listing. Mm-hmm. And the reason that what you were talking about with the browsers and stuff kind of makes sense in this context is the next wave of what's coming, let's say in 24 to 36 months or so, is going to be the ability for myself as a potential patient to sit down in front of my browser, so whether that's my phone or my desktop or whatever, and say, okay, Perplexity or Chrome or whatever I'm using, I want a list of the top 5 dermatologists within a 10-mile radius of my home. I only want to see dermatologists that are 4.5 or above and accept United Healthcare. Go. And I can actually verbally say that, and it's going to go and find those and then show me them. And if I want, it'll even book me at the highest rated without me actually having to lift a finger. That is coming very soon. And that's why all of this kind of plays together with that new sort of SEO change and shift that you're talking about.
Yeah, so let's talk about specifics, because I think it kind of goes back to like, okay, I know I need to have a good reputation, but how does it actually impact my marketing and my practice? So I'm going to, for those of you who watching this on YouTube, all of these shows are on YouTube. I'm going to share with you some actual data from a live client dashboard. This is a large practice. They're about 25, 30 providers. This is a 90-day snapshot. And so you see from what we're looking at here is from September of 2024 through April of 2025, they maintained roughly a 4.9 star review. And the blue boxes that you're seeing is they were getting, let's just call it an average of 300 reviews per month. And what that was doing was helping them land on that front page of Google and really helping them from an SEO standpoint. Then something happened in May, June, and July where they started getting, let's call it 20 reviews a month. And I can tell you what they did. They turned off the automatic review invites with their patients because they were switching the vendor. They were switching vendors. And they've just gotten them turned back on. And we're recording this mid-August of 2025, and they're starting to pop back up. So they're at a 4.65. However, what happened in the middle, they had a little bit of a public relations crisis in the last couple of weeks. And during that public relations crisis, the people that were upset with them came at their Google reviews and left, 35, 40 one-star reviews. And we, as their marketing team, had to go to Google and have the reviews removed. And then we had to expedite getting this new vendor online to turn the reviews back on. It's related to their EHR. And so it just shows you how quick things change. They went from basically a 4.9 to a 2.73, and now they're back up to a 4.65. If you look at the data, though, and Corey, you can jump in on this, but if you look at it, like in the last 90 days, they had almost 9,700 visits to their website. And when they turned off those reviews, that dropped by almost 20%. They had over 10,000 phone calls from those directory listings. And when they turned off the reviews, it dropped 20%. And on the phone, these directory listings, and we know that almost 70%, if not more, of people are accessing your practice on their phone, not on a desktop. They got 14,000 direction requests from people clicking on their directory listings to get directions to their practice. And when they turned off reviews, those numbers tanked. Directly associates how well they're able to acquire new patients related to just the directory listings on Google.
Yeah, those listings, kind of like we said at the top. So it's not just the star rating, although the star rating is really important.
But it's not the...
No, it's not. But I'll throw one more stat at you that I think drives that home. According to Leap Health, a 1-star increase in a online rating can lead to a 5% increase in patient volume. So if you can go up higher in your ratings, you're going to make more money. Clinic schedules are going to be full. Everyone's going to be happy. In this example, when you turn those things off and then the ratings go down, what you immediately start to see is less clinic volume, which is exemplified by the lack of clicks for directions and phone calls. But again, just sort of kind of trying to paint that full picture. It's not just the star rating, it's also the associated links that come with that. So for example, on Google now, you have the ability to obviously claim that listing. Then you can link to your website. You can also link direct to a booking page, so people can, I don't want to say book from Google, but that's how that's the way that they're going. They're trying to make it to where basically you press a book button and then it goes right into Luma Health or whoever you're using to book. And so coupled with the star ratings, that's kind of what builds that trust and that credibility and that ease. It removes that friction. So again, as a user, I can say, all right, they're rated 4.73. They've got a ton of reviews, so they're obviously legit. I can press this button and book, pretty easy. I'm off to the races. And so all those things kind of coming together as this search behavior kind of shifts, and as we were talking about how these review platforms are changing and evolving, it all comes together to, you know, I don't want to say make or break a practice, but it definitely can make things easier or break some other things on the back end.
Well, and for this practice, and we'll do a separate episode on kind of crisis communication just in general or dealing with a crisis, but they had a real PR crisis in the last couple of weeks. And because they had turned off the review invites and were in the midst of switching vendors, it was an all hands on deck. And it was somewhat of a 911, because all of a sudden things completely changed in our ability to kind of mitigate those negatives. Corey, can you just speak a little bit to this right here, the maps and the search impressions? Because this is valuable information that you should be getting when it comes to your directory listings. And, you know, we'll share with you why we're very focused on Google. And there's one other that we're super focused on right now. But I think it's really relevant because, again, it goes back to, it's not just the star ratings that we're worried about.
Right. So what's nice about the Google listings is they also give you that information about maps. And so what that is it's honestly just people trying to get to your practice. So there's a couple reasons why that's important. One, it shows intent, right? So it tells you who is, how many people are trying to actively get to you or see where your location is. That's valuable information from a marketing perspective. But it also kind of sets you up for being able to say, all right, well, if I am maybe thinking about running a specific campaign, how will I be able to optimize those things and maybe look at other metrics for success? So again, maps and phone call clicks play into that. So if you're running an awareness campaign and you see that your maps and phone call clicks go up, that's another metric that you can use to say, yes, I was driving awareness and attention to the practice that you wouldn't be able to do otherwise if you're not paying attention to those things, or if you're just looking at the overall star ratings. And then if you see that those things start to tank, again, it's an indicator that, hey, something is up here and we need to address this, because to go down by, you know, over a reporting period, to go down by 15, 20%, whatever it is, should raise a couple of red flags.
It should. And then, you know, to drive home, because if you're watching on YouTube, you know, you're looking at these numbers. If you're listening, let me just tell you, you know, this is a 90-day snapshot. And in the past 90 days for this, you know, mid to large size practice, they showed up on the Google Maps over 32,000 times. You know, that's why this is so critical. And they showed up in search just related to this listing almost 200,000 times. So imagine if you're not paying attention to this stuff and what that means. You know, that's 200,000 impressions that you may or may not get because you're not paying attention to what's out there representing your practice. That's why it's so critical.
Well, and if you just kind of zoom out and take a, you know, SEO holistic perspective, you want to, you know, it's kind of SEO 101, but you want to own as much of that initial search results page as possible. And so if you have a good listing that's optimized, so you've got a lot of stars, you've filled in all your information, you've got some photos, you've got some videos, that is more likely to show up when someone is searching. So ideally what will happen is you'll have your Google ads, then you'll have your organic listings. You'll also control maybe Healthgrades or a WebMD or something else that will also show up on that front page. Then you'll have your directory listing on the right side. And what you've essentially done is controlled, let's call it 50 to 60% of that first page of Google. So your competitors cannot show up there. And so that's a great way to, play a little defense and offense at the same time.
Yeah, and I think it's just good information. I mean, hopefully all of our listeners out there or viewers know how important reputation management is, but maybe they don't quite understand how it truly impacts the way that patients are choosing their practice, plus the data of how it's connected to the larger ecosystem and how important that is for you.
Well, and you mentioned how patients are choosing practices. So I just want to drive home that we've been talking a lot about Google, but the other one that we're really paying attention to is Healthgrades, because for a lot of insurance providers, those listings on the insurance sites, so if someone's going to see who their provider is, those reviews oftentimes are powered by Healthgrades. So Healthgrades is the other important one because, again, going back to that dermatology example I mentioned, so if I hop on my United Healthcare app and I'm looking for a dermatologist around me, and I can sort by reviews, they're coming straight out of Healthgrades. So that is the other one to have a keen eye on, because that directly impacts people as they're going to make that decision. Like right before they hit the button, they're going through their insurance, they're seeing who's close and how well they're rated, and that's coming from Healthgrades.
So if you are only going to focus on a couple right now, we say where we're putting our energy right now is Google and the Healthgrades.
Mm-hmm.
Google will trickle down to the other listings, the other directories. But we know for a fact that the way that patients are finding you are on Google and Healthgrades, and everything else should give you pause if you're going to put energy into it. But I think this is a good place to talk about some of the changes in the industry. And the reason I say that is way back in the day, when we were managing or helping our clients with reputation management, we use a software vendor that helped us aggregate everything together, made the, great, pretty reports, everything that goes with it. But along the way, the landscape has changed. So we've seen this a lot in the last 18 months. And so to give you an example, and some of you are going to get cringe when I say this, but remember when it was easy to claim your practice on Google? And now you physically have to take a video of you unlocking the front door, and you have to send blood basically and your birth certificate just to prove you have access. Back in the day, you could use a third-party vendor and they could help manage your Google listings for you. Now you have to work closely with your vendor because you've got to get ownership of them. And the same thing with Healthgrades. So many vendors out there will claim that they can manage your Healthgrades, but they cannot manage your Healthgrades because Healthgrades doesn't allow it. They can tell you, hey, you got a review on Healthgrades, but they can't physically necessarily go in there and respond to your review because Healthgrades is a closed loop system. They will not allow others in there. And, it's just kind of an indicator how these providers are changing. But at the same time, now the companies that help manage the reputation for you, they are changing as well. And we've started to see this in the last 18 months. And I think we should talk more about it.
Yeah, it's a great point. And, a lot of those places too, what I think has happened is there's a lot of smart people out there. And so they figured out what these APIs are and said, I can build a software kind of around this. And so, whereas let's say 5 years ago, this was sort of a newer kind of thing, and people were signing contracts for thousands of dollars a month, and just to get it under control. Those have now been commoditized, and it's a race to the bottom for all of these different vendors. So, and I mean, if you Google, reputation management, healthcare, you're going to see dozens and dozens of them. And And the problem is they all do the exact same thing. So they're just competing on price and how pretty the report is, kind of thing.
They
And then,
some of them have their own little differentiators, and they're
sure,
like spreading their wings, but that's what we're seeing.
right, and they're spreading their wings a little bit because they were getting boxed in like that, and so they're trying to do something else to fight for survival or to get bought and get out of the game, kind of thing. Um, But as that's happening, the other shift is like what you mentioned with Healthgrades, where Healthgrades is now kind of locked down and said you have to be a member of the practice. You have
Mhm.
to have a email address that is associated with the practice URL to even talk to us. And so again, I don't know if other ones are going to start to do that too, but that is a result of Healthgrades wanting to try and own as much of the rails as possible that they can. And these other reputation management companies, same thing. They're changing their pricing, their agreements, their features, their automations, because they're just trying to lock people up.
They're offering, they're dabbing into other areas. They're trying to become, marketing systems or platform systems where, there's some that, do data and direct mail. There's some and that are very expensive. There's some now that are doing social media management, or they're doing chatbots or things. And just like everything, when you spread yourself thin, you're, mediocre at best at any, you're not, like, what is it? Master of none. Um,
Yeah.
you're a master of none when it comes to this, because that's
Mhm.
what's happening. And then I think one of the biggest shifts outside of Google and Healthgrades changing the way that they do business, and they need to, because I will tell you, Google is not this locked down as it relates to non-healthcare. Like if you open a restaurant, you can claim that Google listing. You're not like given blood for it. But with
Mhm.
a medical practice, you are. But what we've really noticed, the biggest catalyst to these changes that we've noticed, is your EHR is now offering to send review invites, and you don't need these third-party providers to do the most important piece. So if you go back and look at the screenshot I shared, where the practice that we were working with was in the mix of changing providers, they were switching to a new EHR, and we said, look, you can save a significant amount of money if you have the EHR send the review invites for you. And we've been working with the EHR provider and the tech stack there to make sure that the invites are going to the right places and that they're saying the same thing. But for this practice, we're able to save them several $1,000s a month, because we've switched from like all-inclusive vendor who also does other stuff. And because they had nice fancy dashboard reports, we were all sucked in. But now the EHR does it. It's not as sexy looking, but we're in more control, and we're saving thousands of dollars a month. And that's where the biggest shift has happened.
Yeah, and so yeah, it comes down to how many of those bells and whistles do you actually need versus what's going to give you the biggest bang for the buck, while allowing you to either adjust your budget or spend on other things. Because like we were saying at the beginning, if the main thing that you want to do is review and monitor what people are saying about you, and then just kind of know what that conversation is. Maybe you could just pay for something that does that, and then have the EHR send out the review invites, and you're going to wind up saving a bunch of money versus going with the all-inclusive platform that has a dozen features, 10 of which you're not going to use.
That's right. So that's exactly what we've done. And that's what I want to talk about. We've been doing this now. January of 2026 will be our 20th year working in healthcare, working with healthcare practices. And we've seen this evolve over the years. We saw when the very first listings came onto Google, and we had an enterprise level relationship with multiple reputation management companies over the years, to the tune of 100,000 plus a year in a very discounted rate to pay for it. And it was our single largest vendor expenditure. And the more and more we worked with these vendors, and we've worked with so many of them, and we've had access under the hood with other clients who had another vendor relationship, we just continue to see that, things that are getting promised are not always being delivered. And as Google and Healthgrades and all of the others have started changing and making it more and more difficult, what we were paying for was not necessarily working for our clients anymore. And so we used our web dev team to build a solution that does everything that we need to do, which is tell me when someone leaves a review, respond to all the positives for me, escalate the negatives to a person on the team that can go to the practice, and provide me a dashboard level report that shows me my star ratings, what people are saying about my doctors, what my NPS score is, show me the kind of traffic that I'm getting from it, focus on Healthgrades and Google, and the rest work with the EHR company to send the review invites. And we kind of alluded to it, just the EHR integration alone with the practice that we use as the example, thousands of dollars a month in savings. And then on top of it, we found that our solution that we've now built is another 50 to 70% off of what our practices are paying for now. So now you go from something that is probably one of your largest vendor relationships for software, for marketing software, to something that isn't even going to impact you, but it's still doing all the same thing. And I just think that things have evolved, and if your contracts are coming up, it's really, we can control this expense, and the economies of scale have really got it down. So now's the time to be looking at those relationships.
Yeah. And one of the other things that I think that's beneficial too is that data can get wrapped into a dashboard that's in the same place as the ad data, the social stuff. So you kind of have one place to look at all of those things instead of saying, well, I want to pull a report on my social, so I got to go over here. I want to go look at reputation, so I got to go over here. And I want to go look at analytics, I got to go over here. So I'm being able to sort of have all those things centralized, especially as you're in time crunch and you just need to pull a number real quick, makes a big difference.
Yeah. And look, back in the day, you wanted all those bells and whistles because you thought that it was being handled, but the system has changed enough that it's probably not being handled. So now is a really good time to look at your contracts. If you're looking in 2026 of ways that you can save money, it's a conversation with your EHR. It's a conversation with us or whoever's doing your marketing for you, because there is money on the table and you should be able to take advantage of that. And I'd say this too, be really careful about understanding the contracts that you're in, because desperation will lead to unscrupulous activity. And we have a client that, just as an example, just this past week, who is not going to be able to get out of their contract because they missed the deadline.
Yeah. Yep. I was just in a meeting the other day about that. And there was an out clause. She missed the deadline and they are not right by a couple of days, and they are not being they're not going to help. And we'll just say that.
I know for a fact she's paying somewhere between $5,000 and $10,000 a month. And so think about it. They're having to, we're either cutting overhead or, having to furlough staff on occasion. We don't know what's going on with tariffs. And, we know the healthcare is always going to continue moving the way it's going to move. But the reality is it's taken from the bottom line, and that could be money going to hire the next person or get a piece of equipment you need. And instead, it's a vendor that's really just not willing to make adjustments because the industry is in flux. And now is an opportunity for us to all take advantage of the fact that we have an industry in flux.
100%. Yeah. And I think, the other thing to know is as this reputation management, it's 100% becoming more automated. It's 100% becoming central to practice growth, patient trust. We know all the good things about it. And so now kind of the next step is just saying, all right, well, how can we make sure that the juice is worth the squeeze? How do we make sure that whatever we're spending actually makes sense from a return perspective, and we can track those things, and we're putting our best foot forward, and the rest will take care of itself.
Yeah, absolutely. And I think that I'm going to end it with this. This is not a sales pitch. We will happily show you what we built. I think we're excited about it because we're proud of it, because we've been working in these trenches for years, and we see an opportunity to save practices money. And if you can save yourself some money and that frees up something else, then, so be it. But no matter what, it's time to review our contracts as we go into 2026, because directory listings and reputation management is so important to your practice, but it doesn't need to cost an arm and a leg.
Yeah, and whatever solution you decide to go with, if you're not paying attention, it's time to start. And this, lean into the tech, lean into the transparency, because that's going to provide nothing but positives along the way.
That's right. So with that, I'm Jennifer.
I'm Corey.
We'll see you next time on the Dr. Marketing Tips Show. Thanks a bunch.
Okay.
If you want more like this, hit like and subscribe so you'll always be alerted to new episodes when they come out. And if you want information about us, visit us over at insightmg.com. That's insightmg.com. We'll see you on the next episode.